welcome all of our guests who are tuning in virtually. I'd also like to welcome Abby Nagby. She is a prospective member. And now, to introduce our keynote, we have past President Jim Ronstadt. He's been a member since June of 1980, a Sal Point and U of A graduate. He's with Ronstadt Insurance. Jim is very passionate about Polio Plus, eradicating polio, and spending time with his kids, grandkids, and great-grandkids, enjoying them to the fullest. Jim.
Thank you, Jen. It's a real pleasure to be here. This is normally Rotary Rodeo Month. We won't be wearing any rodeo gear, but I will be. So if you want to join me from now on, anytime, I've loved this month for a long time. It's my pleasure as Vice President of Government Relations for Public Policy for Blue Cross Blue Shield of Arizona. Chuck Bassett is responsible for formulating and organizing the organization's public policy and all local, state, and federal government relations. He serves as the organization's contact for all legislators, government officials, community leaders, and media regarding legislative issues. Prior to joining Blue Cross Blue Shield, Chuck was an insurance regulator attorney for a Phoenix law firm. He has also served as rules attorney and ethics counsel for the Arizona House of Representatives. Chuck is on the Arizona Chamber of Commerce and Industry Board of Directors and the Arizona Chamber Foundation Board. Chuck received his law degree and bachelor's degree from the University of Arizona. He is a member of the State Bar of Arizona. Please help me welcome Chuck Bassett.
Good afternoon, everybody. Good to see everybody. Am I starting, Dan?
You're good.
All right, good to see everybody. Well, I can't really see you, but it's good to be with you. I'm kind of jealous that you're all in a room actually together. I almost remember what that was like before. So, in case my academic credentials didn't give me the Tucson street cred I need, I brought in my lighted U of A icon here to help me out a little bit. I want to start off just by kind of recognizing that our country is really divided. So is our state. And on the big issues, people are kind of like 50% on this side, 50% on that side. And it's a time of crisis too, not to mention COVID, but there's chaos around us. And I mean, you don't have to look any further than GameStop and the silver market right now to see that. And we're all kind of required to move faster, but with less certainty. And that's true in politics too. So it may feel like politics, and healthcare politics in particular, may not feel like the safest place to have a discussion right now. But I think today we can serve as examples for everybody else and show that there's stuff that's worth discussing, and that we can do it in a respectable and polite way with each other, even when we disagree. And my goal is to provide completely fact-based analysis. I may make fun of people along the way, but in a loving way. And I hope that when I'm done, you have no idea which party that I'm associated with. I'm actually associated with neither party, but I don't want to show my political stripes at all. So let's start by looking at the political environment. As we just covered, it's pretty ugly out there right now. There's this hangover from the election where we're really divided. You see some factors that are making politics really interesting right now. And one is increasing populism. And that's on both sides of the political fence. The Democrats and the Republicans are electing increasingly populist people to the legislature and to Congress. So there's less respect, I guess, or deference to chambers of commerce, big industry, and even government itself with this populist streak. We're also seeing a clustering at the ends of the political spectrum. I saw a presentation by some federal lobbyists, and they did an analysis of congressional voting. And it went from the 1960s, I think, through the 70s, 80s, 90s, into 2000s. And there's been this steady erosion since the 80s of votes where Republicans vote for Democrat bills and Democrats vote for Republican bills. And instead, Republicans are voting for only Republican bills and Democrats are voting for only Democratic bills. So they're kind of clustering on the far sides, and there's not a centrist element in politics as much. And we're seeing that in Arizona too. Just in the last election, the state legislature lost two moderate Republicans, and these were Republicans who often worked with Democrats. And coincidentally, they were both leaders on healthcare issues. It was Senator Heather Carter and Senator Kate Brophy McGee. They've both been health committee chairs, and one of them lost in the primary election, and one of them lost in the general election. And that kind of cut out the middle for the Republicans. It's a much more conservative group now. And it's interesting because the Republicans in the state legislature hold control of the House by one vote and hold control of the Senate by one vote. And you'd think that because of those tight margins, people might work together a little bit more. But in fact, it seems like it's even a little bit more partisan than it was, even with those narrow margins. COVID, of course, also makes policymaking really interesting. One factor of COVID is policy can be made on a dime. Everything changes on a dime. If you think about some of the governor's executive orders, from our perspective, the governor said that COVID testing, vaccinations, and treatments would all be given without cost sharing. So that dramatically changes our contracts. And maybe that was the way to go, and we're willing to do our share. But suddenly to have no cost sharing, with no debate, no vote, no nothing, is pretty interesting policy making. And then you also have to ask, with the Republicans holding a one vote advantage in each house, what happens if there's a COVID outbreak at the legislature? If they lose a vote or two, they can't push the issues that they want to push. So it's going to be interesting to see if they can make it through this session, or whether they're going to have to sort of abandon ship like they did during the last legislative session in March. And I think it's also fair to say that everyone's kind of under more strain these days. There's just a lot more, it feels like a lot more expected of us, and just kind of people aren't as happy as they usually are. So that's kind of the political environment that I'm seeing. And at the legislature, you need to understand that the nature of the legislature is fast. Congress can dawdle along. They have 2-year sessions, and they don't get that much done. They can move fast, but they often don't. But the legislature, the moment they go into session, it is pedal to the metal. And I'll just say that we've been in session for 15 days. Okay, it started in early January, and there have been more than 1,700 bills introduced in the state legislature. So it's a busy group of people, and they're pushing paper. And as an insurance lobbyist, I have to read every one of those 1,700 pages or 1,700 bills, and every one of the amendments they pass to see if there's an impact on my company or on the industry or something like that. And we're tracking probably 400 bills at this point in legislative session. So it's a real just a river of paper moving really fast. So let's go to the federal side. I'll give a federal update and a state update. As you know, at the federal level, we have a new president, President Biden, a Democrat who's in the White House. The Democrats retained control of the House as we expected them to, and so Speaker Pelosi remains in power. And then what wasn't expected was that the Democrats won both runoff elections for the Georgia Senate seats in early January. We expected, all the experts expected the Republicans to at least hold on to one of them. But since they lost both seats, it's a tie now in the U.S. Senate. And the tiebreaker, of course, is Vice President Harris. She's the tiebreaker, so Democrats effectively control the Senate. Big changes in Washington. A new party controlling the White House and a new party controlling the Senate. President Biden is now changing what he can through administrative actions. President Trump did a lot of that through rulemaking and executive orders, and President Biden is now sort of undoing a lot of that, from everything from immigration to environment to healthcare. And let's take a moment and look at what he's up to on healthcare. First of all, President Trump was putting through a lot of last-minute rules that actually didn't even make it to the Federal Register yet. And if they didn't make the Federal Register yet, President Biden has issued an order saying that they're going to be stayed for a while. They're going to take some time to look at them. And they've also delayed some effective dates for rules that had already been published. For example, the rebate rule deals with prescription drugs. Another set of executive orders are focused on helping people get coverage throughout the pandemic. Most of these orders are not very specific. They kind of alert agency heads to what the president wants to do and says, listen, keep an eye on these issues and see if we can act on them. But one is very specific, and that it's going to create a special enrollment period on the exchange. So people who buy their own insurance can have this special period because open enrollment ended a long time ago. There's going to be a special enrollment period to reopen the exchanges, and people can purchase their insurance again. And this is designed for people who have lost work during the pandemic and that sort of thing. Another aspect of that is that the Trump administration really decreased funding for navigators, and navigators are people who market and give people information about the exchanges. The previous administration pulled back financing for that a lot. The new administration has pledged to increase financing for outreach on the exchange. They're focused on protections for people with pre-existing conditions with COVID, which is interesting to me because there's already protection for people with pre-existing conditions no matter what, so I don't know why COVID is any different. And we also expect the administration to take a hard look at things like association health plans, short-term limited disability, or short-term limited duration insurance policies, and Christian sharing ministries. These were all things that Republicans had embraced in previous administrations to kind of get around the ACA, to give people options around the ACA. What President Biden would like to do is increase access to the ACA and decrease options for sort of steering around it. And then, of course, the president is working with Congress now on the latest COVID-19 package. I don't know, is this the fourth one or the fifth one? I've sort of lost track. But the president and Democrats won about a $1.9 billion package, and the Republicans were leaning more like, let's do 600 instead. And it looks like they were trying to work it out on a bipartisan basis, but it's not going to work out now. So what the Democrats are going to do is go through the reconciliation process to pass the next COVID-19 package. And what that means is, in ordinary legislation, you need 60 votes in the Senate to pass it. With reconciliation, you need a bare majority, so they just need 51. And they've got that if the Democrats stick together and the vice president supports it. And they're doing this because they can't reach an agreement with the Republicans on what's going to be in that COVID-19 package. The reconciliation process comes with a cost, though, and it's going to limit the types of things they can do in the legislation. So they'll get something done, but it won't be exactly what they want. And one more thing on the federal side, this sort of feels like old news to me now, but at the end of the year, Congress passed a big budget deal, and part of that related to surprise billing. You've probably all been familiar with surprise billing. It occurs when a patient goes to an out-of-network doctor and then gets a bill from that out-of-network doctor, and they call it a surprise because it's usually in circumstances where they would have expected that doctor to be in the network. And it's kind of unfair for the patient because they're sort of caught in the middle. They expected to have coverage, they did the right things. In a lot of cases, this happens in an emergency context, so they didn't even have a flu. A lot of times it'll deal with an anesthesiologist or some other sort of specialty that you don't even see. Maybe somebody doing lab work. So policymakers have wanted to solve this problem. And at the state level, 3 years ago, Arizona enacted legislation, but that only deals with state-regulated insurance. So if you're buying it on your own or if you're a small employer. Now the federal government has acted, and it's going to apply to big self-funded plans and others. So what we're going to have is two different ways to go through arbitration to settle these surprise bills. And the good news for the patient is both of these scenarios take the patient out of the middle. It's between the insurance company and the providers, which it really should be. It's just not fair to have the patient wrenched in between them. So they passed that at the end of the year, and we'll look forward to seeing how that works out. Next, I want to move to the state legislature. And, you know, it's really easy to find yourself cynical about the state legislature, and I often do. But I have to remind myself, these people make $24,000 a year, and it's really busy. They work very hard. The hours down there are tough, and granted, they're not in session all year. They're supposed to be in session 4 or 5 months a year, but it's demanding during that 5 months, and there's also things that they do the rest of the year. And I think that most of them are really trying to represent their constituents and really trying to do the right thing. And they do some good things. I mean, our Constitution requires them to pass a balanced budget every year, and they do. And that's something that we ought to be grateful for. And for the most part, they have 0 personal staff. And so they're doing a lot of that work themselves. And I always ask myself, as I'm critical of them, would you do it? And the answer is absolutely not. I wouldn't, especially in this social media age where everybody's hammering everybody. So I want to start off my comments by, sort of expressing gratitude to the legislators who are willing to get out there and serve for what turns out to be a really thankless job. So, like everything else, COVID is a big focus at the state legislature. And like everything else, it's really divided. The governor's been criticized by the left and others, for not having a mask mandate, generally not doing enough to address the COVID crisis. The governor's criticized from the right for doing too much. When he locked down the sort of stay-at-home order, which wasn't really the stay-at-home order, people were very upset about that. A lot of Republicans don't want there to be a mask mandate. And he's been criticized on the right. And I'll just tell you, back in April, when they were leaving session and the governor was putting these executive orders in place, there was a real chance that the legislature was going to go back into session and overrule some of these executive orders. So I think he's done what he can to sort of navigate this tricky political scenario that he finds himself in. And now there's a bunch of legislation in this new session related to executive orders and emergencies and pandemics. The most important one that I've seen is a liability bill that gives businesses and healthcare providers who had to confront maybe scarcity of resources and really tough situations that had to make decisions on the fly to protect them against liability from lawsuits. And that's now working its way through the legislature. There are also lots of challenges to the governor's power about, can he issue an executive order, for how long, and for how can it go, and does the legislature have some role in maybe overseeing those executive orders? So a lot of discussion about that, about the pandemic out there. Another issue that's sort of related to the pandemic is telemedicine. You may be aware that one of Governor Ducey's early executive orders in the pandemic was to say that insurance companies had to cover all telemedicine in any form. I mean, just pick up the phone or FaceTime or Zoom or whatever it was, and we had to pay the same reimbursement to the provider as it would have been for an in-person visit, even for the phone calls. The reasoning, of course, was to get people to see their doctor virtually rather than making that trip out to the doctor's office, which was dangerous, probably still is in some cases, and to also help keep those providers afloat. The result was to dramatically increase the use of telemedicine. And we saw it, 1,700% in some cases. I saw in another state 3,300% increase in telemedicine. So it really brought telemedicine into being. I think providers have been reluctant to use it in the past, and suddenly they had to use it, and they figured it out, and I think a lot of them liked it. So now the governor basically wants to codify that executive order. You heard him mention telemedicine in state-to-state address. The coverage is already mandated. Insurance companies have to cover telemedicine services. But now, under this legislation, and it just passed Health Committee last night, the reimbursement has to be at parity with an in-person visit. Now, I don't know how you feel about this. We actually did some surveys on it. We surveyed some of our providers, and the providers, 80% of them said We think reimbursement should be exactly the same for telemedicine as it should be for in-person visits. We surveyed our members, and about 80% of them said, we do not think it should be as high as an in-person visit. So there are different opinions about whether the reimbursement ought to be the same or not. But even if you agree with the payment parity, I wonder whether it should really be extended to telephone calls. And this legislation does extend it. Some of our arguments against this, we support the bill, but we're concerned about this extending it to telephone calls. And the reasons are as follows. First, telemedicine has always been sold as a new technology. Look at this video capability we have, and we can hook it up to monitors and get feedback from the patient, and it's almost as good as being there. Telephones are not new technology, and I think the last doctor's office in the country probably got a telephone in the 1940s. And we're concerned that telephones may be used more for the services when they're clearly inferior and increasing costs, because from our perspective, telephone calls are built into the rates already. If a patient calls in and wants to get a refill, for example, and the office handles that, it's sort of included in the visit. We also think that it may encourage providers not to invest in real telemedicine equipment, which is clearly superior than a phone call. And finally, can we have technology benefit healthcare as it does in other industries? In other industries, technology always drives costs down. In healthcare, it always drives costs up. And it would be great to see that drive costs down. Now, with all that said, it may be perfectly appropriate to have to pay full freight for some phone calls. Behavioral health may be a good example. And there may